In this video, I am going to speak about some of the tips for using plate haptic design IOL. As you know that there are many designs for intraocular lenses from loop haptics to these plate haptics, and I use this plate haptic IOLs quite often, and many newer IOLs are in this design. It gives a better centration. It resists the capsular phimosis and also has better stability in toric IOLs. So few surgeons are not so comfortable using this type of design. So I'm going to give you some tips how to use this type of IOL and what are the things you should be looking out for. And first thing to remember is just like all other cases as well, avoid very small capsular axis, particularly for plate haptic. If you have very small rexes of 4 or smaller, it becomes very difficult to push this haptic in the back. So it's better to have around 4.5 to 5 capsule rexes. I use cohesive OVD to inject the IOL. So the removal of OVD is easier after it inserted in the bag. Make sure that the leading haptic goes into the bag and direct it towards the equator of the lens bag rather than towards the posterior capsule. This IOL being bulkier needs some space to unfold, so don't push your injector cartridge or tip of the injector into the anterior chamber far. And to push the trailing haptic in the bag, you need slightly higher force, and also the Sinski should be pushing at the periphery of the optic rather than towards the center of the optic. If I push the center of the optic, many times it's difficult to push the trailing haptic into the bag. And here, and this is happens because you are used to loop haptics, and then you feel that you should not be pushing that much of force. Here I am making a mistake that I am trying to push the haptic into the bag by pushing the near the central part of the optic, but you should be pushing in the peripheral part of the optic. So here what I am going to do is I push some adrenaline to dilate the pupil so that I visualize the haptics properly. You can also use iris retractors if the pupil is too small, and now you can see that a part of the capsular axis is actually behind the IOL, indicating that these trailing haptics are in the sulcus. So now I'm going to align, because this is a toric IOL, I'm going to align it along the axis first, and then you can see my Sinski is at the periphery part of the optic, and then it's easier to push these haptics into the bag. So first haptic or one side of the haptic is into the bag now, and I'm pushing now the second part of the haptic. And now you can see that the capsular axis is now fully covering the optic, indicating that now the both haptics are in the bag. And you can also then align this toric IOL according to the axis. Before that, you can remove the OVD completely from the anterior chamber. Also, make sure that you remove the OVD behind the IOL as well. Sometimes, because it appears like a large IOL, you are hesitant, but make sure that you can nudge the IOL to one side, and as I showed, you can remove the OVD from the bag. Before you close the case, make sure the IOL is in the perfect alignment with the toric mark, and this is easier to rotate into the position irrespective of the position of the IOL, because like in loop haptics you have to dial always clockwise, but it doesn't need here because it has a plate haptic. So those were some tips and tricks for using plate haptic. I'm sure it was useful. For more such videos, do subscribe to my YouTube channel, and you are welcome to our training center.